Question 1. Patient care and safety. Mr. Davis, a 75-year-old patient with a history of hypertension and arthritis, is scheduled for a chest x-ray. He expresses anxiety about the procedure and is concerned about his arthritis causing discomfort during positioning. Which of the following actions should the radiologic technologist take to best address Mr. Davis's concerns and ensure his comfort during the procedure? A. Perform the chest x-ray without any adjustments to positioning, as the procedure is standard for all patients. B. Offer reassurance to Mr. Davis explaining the procedure and adjust the positioning to minimize discomfort caused by arthritis. C. Postpone the procedure until the arthritis is under control with medication. D. Administer a mild sedative to Mr. Davis to alleviate anxiety before proceeding with the x-ray. Answer. B. Offer reassurance to Mr. Davis explaining the procedure and adjust the positioning to minimize discomfort caused by arthritis. Explanation. Patient comfort and reassurance are key components of providing quality patient care in radiology. According to guidelines, the technologist should communicate with the patient to explain the procedure and adjust positioning to minimize discomfort, especially for elderly patients or with musculoskeletal conditions like arthritis. Postponing the procedure or administering a sedative without proper medical orders would not address the immediate need to ensure comfort and may introduce unnecessary risks. Additionally, it is important to provide emotional support to patients, as anxiety can exacerbate physical discomfort. Question 2. Radiation protection. In a fluoroscopic procedure, the technologist notices that the radiation dose to the patient is higher than expected. The patient has been positioned in a way that requires longer fluoroscopic time to achieve the necessary images. Which of the following actions is the most appropriate to minimize the radiation exposure while still obtaining the required diagnostic information? A. Increase the fluoroscopic exposure time to obtain clearer images without further adjustments to positioning. B. Use the as low as reasonably achievable ALARA principle and adjust the positioning to reduce the need for prolonged fluoroscopic exposure. C. Decrease the intensity of the fluoroscopy beam without changing the patient's position to reduce exposure. D. Discontinue the procedure immediately, as the patient may have already received radiation. Answer. B. Use the as low as reasonably achievable ALARA principle and adjust the positioning to reduce the need for prolonged fluoroscopic exposure. Explanation. The ALARA principle is cornerstone of radiation protection, aiming to minimize radiation exposure to patients and healthcare workers while achieving diagnostic quality. Prolonged fluoroscopic exposure increases patient dose, so the technologist should focus on positioning to reduce the need for extended fluoroscopy time. Increasing exposure time, option A, or simply adjusting the beam intensity, option C, does not adhere to ALARA. Discontinuing the procedure, option D, without assessing the situation could lead to incomplete diagnostic results. Therefore, adjusting positioning and reducing fluoroscopic time is the best method to ensure patient safety while maintaining diagnostic accuracy. Question 3. Radiographic pathology, scenario MS. Thompson, a 40-year-old woman, presents with sudden onset of chest pain and difficulty breathing. A radiograph reveals a suspicious opacity in the right lung field, and further evaluation with a key is ordered. Based on the imaging findings, what is the most likely diagnosis, and how should the radiologic technologist proceed to assist in confirming the diagnosis? A. The most likely diagnosis is pneumonia, and the technologist should perform a follow-up chest X-ray to monitor progress. B. The most likely diagnosis is a pulmonary embolism, and the technologist should assist with obtaining a contrast-enhanced CT scan to confirm the diagnosis. C. The most likely diagnosis is lung cancer, and the technologist should proceed with a biopsy immediately. D. The most likely diagnosis is a fracture, and the technologist should adjust the patient's positioning to confirm the injury. Answer. B. The most likely diagnosis is a pulmonary embolism, and the technologist should assist with obtaining a contrast-enhanced CT scan to confirm the diagnosis. Explanation. Based on MS, Thompson's symptoms, chest pain, difficulty breathing, and the radiographic finding of a suspicious opacity in the right lung field, the most likely diagnosis is a pulmonary embolism, which can cause lung opacities on imaging. Contrast-enhanced CT scan is the gold standard for diagnosing pulmonary embolism and should be performed to confirm the diagnosis. 1. Pneumonia, option A, can cause similar symptoms. The immediate concern in this case is P, which is a life-threatening condition. A biopsy, option C, or further focus on rib fractures, option D, would not be appropriate in this scenario without further clinical evidence. Question 4. Radiologic procedures in specialized areas. During a mammography procedure, the radiologic technologist notices that the image quality appears suboptimal with slight motion artifacts. The patient is unable to hold still for the required compression due to discomfort. Which of the following strategies should the technologist implement to improve image quality while ensuring the patient's comfort? A. Increase the compression force to ensure the breast tissue is adequately spread even if it causes some discomfort. B. Allow the patient to relax, reducing compression but accept a lower image quality. C. Educate the patient on the importance of staying still during compression and consider using a shorter exposure time to reduce motion artifacts. D. Discontinue the procedure and recommend rescheduling it when the patient is in a more comfortable. Answer: C. Educate the patient on the importance of staying still during compression and consider using a shorter exposure time to reduce motion artifacts. Explanation: in mammography, proper compression is critical to obtaining high-quality images by reducing tissue overlap, minimizing radiation dose, and improving image resolution. However, patient comfort is essential to maintain optimal positioning without causing distress. Educating the patient on the importance of staying still can help reduce motion artifacts, and reducing exposure time is also effective in minimizing artifacts while ensuring diagnostic quality. Option A increases compression unnecessarily, causing discomfort, and B compromises image quality, which is not acceptable in mammography. Option D might delay necessary diagnosis without resolving the current issue effectively. Question 5. Radiation protection. During a fluoroscopic procedure, the radiologic technologist is using a lead apron for radiation protection. However, the apron is not positioned correctly, leaving part of the technologist's body unprotected. What is the most appropriate action to minimize occupational radiation exposure while continuing the procedure? A. Continue the procedure without adjustment as the apron provides some protection. B. Stop the procedure and adjust the lead apron to ensure proper coverage of the technologist's body. C. Move the technologist to position outside the radiation field to avoid exposure. D. Increase the fluoroscopic exposure time to reduce the amount of radiation used during the procedure. Answer: B. Stop the procedure and adjust the lead apron to ensure proper coverage of the technologist's body. Explanation: radiation protection for healthcare workers is paramount, and personal protective equipment (PPE) such as lead aprons must be correctly positioned to ensure maximal protection. If the apron is not positioned properly, there is risk of unnecessary radiation exposure, according to the ALARA, as low as reasonably achieved. Principle: any lapses in protective measures should be immediately corrected. Option A is not acceptable, as even partial coverage does not ensure safety. Moving the technologist outside the radiation field. Option C is not always feasible, and increasing exposure time. Option D is counterproductive in terms of reducing radiation exposure. Question 6. Imaging procedures. A patient is scheduled for an abdominal CT scan with contrast, but they are allergic to iodine-based contrast media. What steps should the radiologic technologist take to ensure patient safety and the proper execution of the imaging procedure? A. Proceed with the iodine-based contrast media as planned, since the risk of a reaction is minimal. B. Administer a different type of contrast media without notifying the radiologist or physician. C. Inform the radiologist of the patient's allergy and work with the medical team to consider an alternative imaging modality or contrast agent. D. Delay the procedure until the allergy test results come back to confirm the allergy. Answer: C. Inform the radiologist of the patient's allergy and work with the medical team to consider an alternative imaging modality or contrast agent. Explanation: patient safety is paramount, and allergies to contrast agents, especially iodine-based ones, must be addressed before proceeding with any imaging procedure. It is critical for the radiologic technologist to communicate the patient's allergy to the radiologist and medical team. Explore alternative imaging modalities, such as MRI or non-iodine contrast agents. Option A is dangerous and irresponsible as it ignores the patient's known allergy, while option B bypasses proper medical consultation and patient safety protocols. Option D unnecessarily delays the procedure and does not address the immediate concern of the allergic reaction. Therefore, collaborating with the medical team is the most appropriate course of action. Question 7. Patient care and safety. A 72-year-old patient is undergoing a chest X-ray. The patient has limited mobility and experiences pain when positioned for the exam. What should the radiologic technologist do to ensure both the patient's comfort and the diagnostic quality of the image? A. Position the patient quickly to minimize discomfort, regardless of image quality. B. Increase the exposure time to ensure better image quality, even if it may cause discomfort to the patient. C. Use immobilization devices and assist the patient in achieving the correct position with minimal discomfort while ensuring optimal image quality. D. Skip the chest X-ray and suggest alternative imaging techniques without consulting the physician. Answer: C. Use immobilization devices and assist the patient in achieving the correct position with minimal discomfort while ensuring optimal image quality. Explanation: when working with elderly or immobile patients, the radiologic technologist must prioritize both patient comfort and diagnostic image quality. Proper positioning is critical for accurate imaging, and immobilization devices can be used to help achieve the correct position with further discomfort. Option A may lead to inadequate positioning and poor image quality, while option B compromises the patient's comfort and may result in unnecessary radiation exposure. Option D is not appropriate, as alternative techniques should only be considered after discussing options with the physician and understanding the clinical necessity of the exam. Question 8. Radiation protection. During a fluoroscopic procedure, the technologist observes that the radiation exposure rate is higher than expected. The patient has already undergone a full abdominal scan and the procedure is extended for an additional diagnostic purpose. Which of the following actions should the radiologic technologist take to minimize the patient's exposure? A. Increase the fluoroscopic exposure time to achieve a clearer image. B. Use the lowest possible exposure settings, decrease the fluoroscopic time, and increase the distance from the radiation source. C. Maintain the current settings to complete the procedure more quickly. D. Switch to a different imaging modality that uses higher radiation levels for faster results. Answer: B. Use the lowest possible exposure settings, decrease the fluoroscopic time, and increase the distance from the radiation source. Explanation: the ALARA principle, as low as reasonably achievable, emphasizes minimizing radiation exposure to patients while still obtaining diagnostic quality images. In fluoroscopy, exposure time should be minimized and distance from the radiation source should be maximized to reduce the dose. Option A increases exposure unnecessarily, which is counterproductive. Option C fails to address the need for reducing exposure. Option D is not appropriate, as it would likely result in an even higher radiation dose. Thus, reducing exposure settings and minimizing fluoroscopic time while ensuring diagnostic image quality is the correct course of action. Question 9. Ethics and professionalism. A radiologic technologist receives a request from a referring physician to conduct an imaging procedure on a patient without informing the patient about the potential risks associated with the procedure. What should the technologist do in this situation to maintain ethical and professional standards? A. Proceed with the procedure as instructed by the physician, as it is not the technologist's responsibility to inform the patient. B. Refuse to perform the procedure unless the physician provides a signed consent form from the patient. C. Inform the patient of the potential risks and benefits of the procedure before proceeding, ensuring informed consent is obtained. D. Delay the procedure until lawyer is consulted to ensure patient rights are protected. Answer: C. Inform the patient of the potential risks and benefits of the procedure before proceeding, ensuring informed consent is obtained. Explanation: informed consent is a fundamental ethical principle in healthcare. The patient has the right to be informed about the risks and benefits of any procedure, and it is the responsibility of the radiologic technologist to ensure that this occurs. Even though the physician may have ordered the procedure, the technologist must ensure the patient is aware of potential risks. Option A fails to uphold the patient's rights, and option B may not be necessary in all cases, as it depends on the type of procedure. Option D is impractical and unnecessary, as the primary concern should be ensuring the patient is informed. Question 10. Imaging procedures during a kidney with contrast. The technologist notices that the patient's kidney function is impaired, as indicated by the latest lab results. The contrast agent to be used is iodine-based, which could potentially exacerbate kidney issues. What should the radiologic technologist do in this scenario? A. Proceed with the procedure as planned, since the physician has ordered the contrast. B. Consult with the physician to determine if A non-iodine-based contrast agent or alternative imaging modality can be used. C. Wait for the patient's kidney function to improve before proceeding with the procedure. D. Reduce the contrast dose by half to minimize potential harm to the kidneys. Answer: B. Consult with the physician to determine if a non-iodine-based contrast agent or alternative imaging modality can be used. Explanation: in patients with impaired kidney function, the use of iodine-based contrast agents can increase the risk of contrast-induced nephropathy. The radiologic technologist must work with the physician to assess whether an alternative contrast agent, such as gadolinium for MRI, or a different modality, such as MRI or ultrasound, is appropriate. Option A may put the patient at risk, while option C unnecessarily delays necessary diagnostic imaging without addressing the underlying concern. Option D may not adequately reduce the risk, and the technologist should not make unilateral decisions regarding the contrast dose. Thus, consulting with the physician is the safest course of action. Question 11. Radiation protection. During a routine radiographic procedure, a radiologic technologist notices that a pregnant patient has been scheduled for a procedure that involves radiation exposure. What should the technologist do to ensure the safety of the patient and the fetus? A. Proceed with the procedure as scheduled and inform the patient afterward. B. Suggest that the patient undergo the procedure without contrast to minimize radiation exposure. C. Consult with the physician to assess the necessity of the procedure and explore alternatives that do not involve radiation. D. Perform the procedure but use the highest radiation settings to ensure the best image quality. Answer: C. Consult with the physician to assess the necessity of the procedure and explore alternatives that do not involve radiation. Explanation: radiation exposure during pregnancy can pose risks to the developing fetus, especially in the first trimester. It is essential for the radiologic technologist to consult with the physician to determine whether the procedure is absolutely necessary and if alternative imaging methods, e.g., ultrasound or MRI, can be used instead. Option A does not take into account the potential harm of radiation exposure to the fetus. Option B may reduce exposure but does not address the core concern of using radiation during pregnancy. Option D is inappropriate as it unnecessarily increases the radiation dose and could harm the patient and fetus. Question 12. Radiographic equipment and technology. A radiologic technologist notices that the X-ray machine is producing images with significant distortion and artifacts despite following the prescribed positioning techniques. What should the technologist check first to address this issue? A. Check the patient's anatomy and positioning again, assuming the issue is related to improper placement. B. Verify that the X-ray machine is properly calibrated and that the image receptor is functioning correctly. C. Adjust the exposure factors to higher levels to compensate for the artifacts. D. Reposition the patient and attempt the image again without checking any equipment settings. Answer: B. Verify that the X-ray machine is properly calibrated and that the image receptor is functioning correctly. Explanation: when image quality issues such as distortion and artifacts arise, it is crucial to first verify the equipment. This includes checking the calibration of the X-ray machine and ensuring the image receptor is functioning properly. If the machine is not calibrated or the receptor is malfunctioning, no amount of repositioning, adjusting exposure factors will resolve the problem. Option A may not address the root cause of the issue, and option C increases the exposure unnecessarily without fixing the problem. Option D neglects the importance of equipment checks, which could lead to recurring issues. Question 13. Clinical competency and evaluation scenario-based. Mr. Rodriguez, a 45-year-old patient, is undergoing an MRI scan to assess a suspected spinal injury. The technologist notices that Mr. Rodriguez appears anxious and expresses concerns about the procedure. He mentions that he has previously had a negative experience with MRI exams, which caused him significant discomfort. What should the radiologic technologist do to ensure the patient's comfort and successful completion of the exam? A. Proceed with the MRI scan without addressing the patient's concerns, as the procedure needs to be done. B. Explain the procedure in detail, offer reassurance, and consider using techniques such as sedation if necessary to help Mr. Rodriguez relax. C. Tell Mr. Rodriguez to relax and assure him that everything will be fine, then proceed with the scan. D. Suggest that the procedure be postponed until Mr. Rodriguez is less anxious and leave it to the physician. Answer: B. Explain the procedure in detail, offer reassurance, and consider using techniques such as sedation if necessary to help Mr. Rodriguez relax. Explanation. When a patient expresses anxiety or discomfort, it is crucial for the radiologic technologist to listen to their concerns and take appropriate steps to ensure comfort. The technologist should explain the procedure, its purpose, and any potential discomforts while offering reassurance. Cases where the patient remains anxious, options such as sedation with physician approval may help ensure a successful and stress-free exam. Option A dismisses the patient's concerns and could lead to poor experience, while option C is overly simplistic and does not adequately address the patient's anxiety. Option D may delay necessary care without addressing the underlying issue. Question 14. Radiologic pathology. A patient undergoes a chest X-ray and the radiologic technologist observes a suspicious mass in the lung. The physician requests further imaging to evaluate the mass more thoroughly. Which of the following imaging modalities would be most appropriate for this follow-up? MRI of the chest to assess soft tissue characteristics of the mass. B. Ultrasound of the chest to examine the mass in detail. C. CT scan of the chest to better visualize the mass's size, location, and effect on surrounding tissues. D. A second chest X-ray to get a more detailed view of the mass. Answer. C. CT scan of the chest to better visualize the mass's size, location, and effect on surrounding tissues. Explanation. In cases where a mass is identified on a chest X-ray, EKG is typically the next step to obtain a more detailed view. CT imaging provides high-resolution images that help assess the size, location, and characteristics of the mass as well as its relationship with surrounding tissues. Option A. MRI may be useful for soft tissue evaluation, but it is not typically the first choice for lung pathology. Option B. Ultrasound is generally not effective for evaluating lung masses due to the limitations of sound waves passing through air-filled structures. Option D. A second chest X-ray would not provide significantly more information about the mass and is not ideal for follow-up. Question 15. Professional responsibilities. A radiologic technologist notices that another technologist is frequently skipping proper radiation protection protocols, such as not wearing lead aprons during fluoroscopy procedures. What is the most appropriate course of action for the first technologist? A. Ignore the issue, as it is not their responsibility to intervene in another technologist's actions. B. Confront the technologist privately and encourage them to follow safety protocols. C. Report the behavior to the radiology department supervisor or manager for further investigation. D. Leave the department and inform the patient about the potential risks posed by the other technologist's actions. Answer. C. Report the behavior to the radiology department supervisor or manager for further investigation. Explanation. Radiation protection is critical to ensure the safety of both patients and healthcare workers. If a technologist observes another individual not adhering to radiation safety protocols, it is their responsibility to report the behavior to the appropriate supervisor or manager. Option A is unethical and could contribute to ongoing safety risks. Option B may be a good first step, but if the issue persists, it is important to involve higher management to ensure corrective actions are taken. Option D is an extreme response and does not address the professional responsibility to report safety concerns through the proper channels. Question 16. Infection control. A radiologic technologist is preparing to perform a fluoroscopy procedure on a patient who has a known history of tuberculosis. Which of the following actions should the technologist take to minimize the risk of infection? A. Perform the procedure in a private room with the door closed to prevent exposure to others. B. Use standard precautions and wear a surgical mask while performing the procedure. C. Follow airborne precautions, wear an N respirator, and ensure the patient wears a surgical mask. D. Ask the patient to wait outside the examination room until all other patients have been seen. Answer. C. Follow airborne precautions, wear an N respirator, and ensure the patient wears a surgical mask. Explanation. Tuberculosis (TB) is an airborne, infectious disease that requires specific precautions to prevent transmission. The appropriate measures include wearing an N respirator, following airborne precautions, and ensuring the patient wears a surgical mask to limit the spread of droplets. Option A does not address the airborne nature of TB. Option B is insufficient because a standard surgical mask does not provide adequate protection against airborne diseases like TB. Option D delays necessary care and does not address infection control. Question 17. Pediatric imaging. A pediatric patient is being scheduled for a chest X-ray. The technologist is aware that the child is very anxious and has a history of difficulty remaining still during imaging procedures. What should the technologist do to help ensure the exam is successful? A. Perform the procedure quickly without any prior explanation to avoid additional stress. B. Explain the procedure to both the child and the parents and provide comfort by offering a toy or distraction to reduce anxiety. C. Sedate the child to ensure they remain still throughout the procedure. D. Postpone the procedure until the child is less anxious and the parents can better prepare them. Answer: B. Explain the procedure to both the child and the parents and provide comfort by offering a toy or distraction to reduce anxiety. Explanation: for pediatric patients, clear communication and reassurance are essential. Explaining the procedure to both the child and the parents helps alleviate anxiety. Additionally, using distractions such as toys or videos can help keep the child calm and still. Option A may lead to additional stress for the child and a poor imaging outcome. Option C. Sedation should only be considered in extreme cases and after consulting with the physician. Option D. May unnecessarily delay care and could lead to increased anxiety over time. Question 18. Patient communication. A patient undergoing a EKI is confused and anxious about the procedure. The technologist has just positioned the patient and is about to begin the scan. What should the technologist do to ensure the patient's comfort and cooperation during the procedure? A. Reassure the patient by briefly explaining the procedure and the importance of remaining still during the scan. B. Proceed with the procedure without saying anything to the patient, assuming they will remain still. C. Ignore the patient's anxiety, as the procedure will be over quickly and will not cause harm. D. Ask the patient to sign consent form for the procedure before beginning, even if they are not fully understanding the information. Answer: A. Reassure the patient by briefly explaining the procedure and the importance of remaining still during the scan. Explanation: effective communication is key to ensuring patient comfort and cooperation during any procedure. Explaining the procedure, its duration, and the importance of remaining still helps alleviate anxiety and improve the chances of obtaining clear images. Option B could increase the patient's anxiety and make it more difficult for them to remain still. Option C disregards the patient's emotional needs and could negatively impact the outcome. Option D is unethical, as patients should be able to understand what they are consenting to before the procedure. Question 19. Radiation dose management. During a routine radiographic examination, the technologist notices that the radiation dose being used for the procedure exceeds the standard recommended levels. What action should the technologist take? A. Continue with the procedure as it is not critical to reduce the radiation dose for routine exams. B. Immediately adjust the exposure settings to reduce the radiation dose while maintaining diagnostic image quality. C. Ask the physician to justify the high dose and proceed with the procedure as instructed. D. Leave the room and request another technologist to perform the procedure without adjusting the dose. Answer: B. Immediately adjust the exposure settings to reduce the radiation dose while maintaining diagnostic image quality. Explanation: it is essential to minimize radiation exposure to patients while ensuring the image quality needed for diagnosis. If the dose is too high, the technologist should adjust the exposure settings to reduce it while still obtaining a diagnostically useful image. Option A is not appropriate, as unnecessary radiation exposure should always be avoided. Option C is unnecessary because the technologist is responsible for ensuring safe radiation practices. Option D does not address the issue of adjusting the dose and could lead to a suboptimal exam. Question 20. Ethical considerations in imaging. A radiologic technologist is asked by a physician to perform an X-ray on a patient without explaining the procedure to them, as the physician feels it is not necessary for the patient to be informed. How should the technologist respond? A. Proceed with the X-ray without informing the patient as instructed by the physician. B. Explain the procedure to the patient to ensure they understand and consent to the examination. C. Refuse to perform the X-ray until the physician provides a written order. D. Inform the patient about the procedure only after it is completed. Answer: B. Explain the procedure to the patient to ensure they understand and consent to the examination. Explanation: ethical and legal considerations in healthcare require that patients be informed about procedures that involve their care. The technologist should always provide the patient with adequate information to understand the procedure and ensure that they give informed consent. Option A is unethical as it disregards the patient's right to know about the procedure. Option C is unnecessary as the technologist is not required to wait for written orders before proceeding with an informed discussion. Option D is inappropriate because it delays communication and may lead to patient distress. Question 21. Contrast media administration. A patient is undergoing an EQ with intravenous contrast media. The patient suddenly complains of a metallic taste in their mouth and begins to feel lightheaded shortly after the contrast injection. What should the technologist do first? A. Reassure the patient that these symptoms are normal and continue the procedure. B. Stop the procedure, notify the physician, and closely monitor the patient for further symptoms. C. Administer oxygen to the patient to relieve their symptoms. D. Document the symptoms and proceed with the scan as planned. Answer. B. Stop the procedure, notify the physician, and closely monitor the patient for further symptoms. Explanation. The symptoms described may indicate an adverse reaction to the contrast media, which can range from mild to severe. The technologist should stop the procedure, notify the physician, and monitor the patient for any worsening symptoms. Option A is inappropriate as the symptoms suggest a possible allergic reaction. Option C could be considered if the symptoms worsen, but the first step should be stopping the procedure and monitoring. Option D would be negligent as it ignores the potential risk to the patient. Question 22. Radiation protection for pregnant patients. A female patient is suspected to be pregnant and is scheduled for an abdominal X-ray. What should the radiologic technologist do before proceeding with the exam? A. Proceed with the exam without concern, as abdominal X-rays are low risk. B. Ask the patient if she is pregnant and proceed only if she confirms she is not pregnant. C. Explain the potential risks to the fetus, confirm the patient's pregnancy status, and consider alternative imaging methods if possible. D. Assume the patient is not pregnant and perform the exam as scheduled. Answer. C. Explain the potential risks to the fetus, confirm the patient's pregnancy status, and consider alternative imaging methods if possible. Explanation. When there is possibility of pregnancy, the technologist must take steps to minimize the risk to the fetus. This includes explaining the potential risks and confirming the pregnancy status. If the patient is pregnant, alternative imaging methods should be considered to avoid radiation exposure. Option A ignores the potential risks and option B might not fully address the situation. Option D is dangerous as it disregards the possibility of pregnancy. Question 23. Pediatric imaging positioning. A 2-year-old child is undergoing a skull X-ray. The child is unable to cooperate and is moving during the exam. What should the technologist do to ensure proper positioning and image quality? A. Hold the child in place manually while the exposure is made. B. Use a pediatric immobilization device to ensure the child is positioned properly. C. Perform the exam without any immobilization, assuming the child will remain still during the exposure. D. Request the parent to hold the child still during the procedure. Answer. B. Use a pediatric immobilization device to ensure the child is positioned properly. Explanation. For pediatric patients, it is important to use appropriate immobilization devices to ensure correct positioning and minimize movement. This helps reduce the need for repeat exposures. Option A may not be safe or practical for a 2-year-old as manual restraint can be difficult. Option C is not appropriate because a moving child will likely result in poor image quality and unnecessary repeats. Option D is not ideal as the parent may not be able to safely hold the child in place and it could cause undue stress for both the child and the parent. Question 24. Patient history and safety. A patient undergoing a barium enema exam tells the technologist that they have a history of severe allergic reactions to iodine-based contrast media. What should the technologist do? A. Proceed with the procedure as planned, as barium contrast is not iodine-based. B. Contact the physician to discuss the patient's history before proceeding with any contrast media. C. Administer mild dose of iodine-based contrast to ensure the patient's tolerance. D. Ask the patient to sign waiver before proceeding with the exam. Answer. B. Contact the physician to discuss the patient's history before proceeding with any contrast media. Explanation. It is crucial to address any known allergies or sensitivities before administering any contrast media. Even though barium is not iodine-based, the patient's history of severe allergic reactions should prompt the technologist to consult with the physician to determine the best course of action. Option A overlooks the patient's history of allergies, which may still be relevant in broader context of contrast usage. Option C is unsafe and may lead to an allergic reaction. Option D is inadequate as it does not address the medical concern or safety of the patient. Question 25. Infection control during imaging procedures. A patient arrives for a radiographic exam and appears to have an open wound on their leg. The technologist notices that the wound is not covered and is exposed during the procedure. What should the technologist do? A. Ignore the wound as it does not affect the radiographic procedure. B. Clean the wound immediately and apply a sterile dressing before proceeding with the exam. C. Postpone the procedure until the wound is properly treated by a healthcare professional. D. Ask the patient to cover the wound with a non-sterile cloth and proceed with the exam. Answer. B. Clean the wound immediately and apply a sterile dressing before proceeding with the exam. Explanation. It is essential to maintain infection control practices during all procedures. The technologist should clean the wound and apply a sterile dressing to minimize the risk of infection, particularly in an imaging environment. Option A is unsafe and disregards basic infection control protocols. Option C may not be necessary unless the wound is severe and it would delay the procedure unnecessarily. Option D is insufficient because a non-sterile cloth would not provide adequate protection against infection. Question 26. Radiation safety in the operating room. During a fluoroscopic procedure in the operating room, the radiologic technologist notices that they are within the primary beam of radiation. What should the technologist do to ensure their safety during the procedure? A. Stand as close to the patient as possible to assist the physician. B. Use a lead apron and stand behind the physician to minimize exposure. C. Move as far away from the patient as possible, even if it means leaving the room. D. Continue the procedure and rely on personal protective equipment (PPE) for safety. Answer. B. Use a lead apron and stand behind the physician to minimize exposure. Explanation. In fluoroscopic procedures, it is critical to reduce radiation exposure to the technologist. The best practice is to use a lead apron to shield the body and position oneself behind the physician or other protective barriers. Option A exposes the technologist to unnecessary radiation. Option C may not always be possible or practical, and leaving the room may compromise assistance needed during the procedure. Option D is inadequate because PPE alone does not mitigate all radiation risks, and positioning away from the primary beam is equally essential. Question 27. Ethics and patient confidentiality. A radiologic technologist is reviewing a patient's medical history before performing an imaging procedure. The patient's medical information contains sensitive details about personal health condition that the patient has not shared with their family. What should the technologist do to respect the patient's privacy and confidentiality? A. Discuss the patient's condition with the physician in the hallway so the family doesn't overhear. B. Review the patient's information privately and ensure that only authorized personnel access the records. C. Mention the patient's condition to the family to ensure they are aware of it before the procedure. D. Keep the patient's medical history visible to others in the department for reference. Answer. B. Review the patient's information privately and ensure that only authorized personnel access the records. Explanation. Patient confidentiality is a fundamental ethical principle in healthcare governed by HIPAA regulations. The technologist must ensure that sensitive information is only disclosed to authorized personnel and that it is kept private. Option A violates patient confidentiality by discussing sensitive information in a public space. Option C disregards the patient's autonomy and privacy rights by disclosing information without consent. Option D violates confidentiality by allowing unauthorized access to patient records. Question 28. Patient assessment and communication. A radiologic technologist is preparing a geriatric patient for a chest X-ray. The patient appears confused and anxious. What should the technologist do to ensure the patient feels comfortable and the procedure is successful? A. Rush the procedure to minimize the patient's anxiety. B. Explain the procedure in simple terms and ensure the patient understands while providing reassurance throughout the exam. C. Ignore the patient's concerns and proceed with the exam as quickly as possible. D. Ask family member to stay with the patient and let them help guide the patient through the process. Answer. B. Explain the procedure in simple terms and ensure the patient understands while providing reassurance throughout the exam. Explanation. Clear communication is crucial. when working with geriatric patients, especially those who may be anxious or confused. The technologist should explain the procedure in simple, reassuring language to ensure the patient feels comfortable and understands what will happen. Option A may increase anxiety and result in poor patient compliance. Option C is unprofessional and neglects the patient's emotional and cognitive needs. Option D is helpful, but the technologist must still provide direct reassurance and clear explanations to the patient. Question 29. Radiologic pathology. Identification of fractures. Radiologic technologist is performing chest X-ray and notices subtle fracture in the patient's rib that was not initially suspected. The fracture appears to be recent injury. What is the appropriate course of action? A. Document the finding and inform the physician immediately for further evaluation. B. Continue with the imaging procedure and rely on the physician to review the images. C. Ignore the fracture and proceed with the examination as planned. D. Discuss the finding with the patient and suggest they follow up with their primary care physician. Answer. A. Document the finding and inform the physician immediately for further evaluation. Explanation. Any suspected pathology, including fractures, should be documented and promptly communicated to the physician for further evaluation. This ensures the patient receives appropriate care and that no critical findings are overlooked. Option B is inappropriate because it assumes that the physician will review the image without alerting them to a potentially important finding. Option C is negligent and could result in a delay in appropriate medical treatment. Option D could compromise the physician's ability to make timely decisions and the patient may not follow through without formal notification. Question 30. Radiation protection. Occupational exposure limits. Radiologic technologist is working in an area with high volume of fluoroscopic procedures. To ensure they stay within the occupational radiation dose limits, what should the technologist do during the course of the workday? A. Use personal dosimeters regularly to track radiation exposure and adhere to the ALARA principle. B. Wear lead apron but assume that radiation exposure from fluoroscopy is not significant. C. Rely solely on the room shielding to protect against radiation exposure, ignoring personal protective measures. D. Take breaks during the day to reduce exposure but avoid using any radiation protection devices. Answer. A. Use personal dosimeters regularly to track radiation exposure and adhere to the ALARA principle. Explanation. Radiologic technologists must use dosimeters to monitor their radiation exposure and adhere to the ALARA as low as reasonably achievable principle to minimize exposure. Regular monitoring allows for early identification of any concerning trends. Option B is incomplete and ignores the need for regular exposure monitoring. Option C is dangerous as it assumes that shielding alone will suffice, neglecting the need for personal protective measures. Option D is incorrect because taking breaks does not address the risk of radiation exposure adequately and it does not reduce the need for proper radiation protection.